Welcome everyone to the ACL FEMA webinar on emergency preparedness for organizations serving people with disabilities and older adults. This webinar is the second in a four-part series focused on people with disabilities, older adults, and the organizations that serve them before, during, and after disasters. Our ASL interpreters are pinned and CART is available. You can enable captions below and you can enable ASL by selecting the interpretation prompt and select sign language. Throughout today's presentation, we will be taking questions which will be addressed at the end of the session or in a follow-up email. Please use the Q&A option as chat has been disabled for this event. Your questions will be added to a repository of questions from this webinar series. It will become a resource as part of the series archive. My name is Casey Knopp, and I am a Management and Program Analyst in the immediate office of the Administrator at the Administration for Community Living, or ACL. I am a white woman with long reddish-brown hair and round gold-rimmed glasses. I will be moderating today's webinar. During today's webinar, we will be focusing on the impacts of extreme heat on older adults and people with disabilities. Following the presentations, panelists will be asked a series of questions about their agency's work surrounding extreme heat. So I'm going to go ahead and introduce our wonderful panelists today. First, we're going to have Rick Nichols, who serves as the Chief of Staff for ACL. In this capacity, he serves as a Senior Advisor to the Administrator, Principal Deputy Administrator, and the agency on policy, program, and operational priorities, ensuring the agency's efforts advance the missions of ACL and HHS. He also provides executive leadership in a number of areas, including disaster preparedness, response, and recovery. Prior to this role, he served in a number of policy and program roles within HHS, and prior to HHS was a policymaker, program manager, and caseworker in the public and private sectors of healthcare and long-term services and supports. Next, we will have Sherman Gillums, who serves as FEMA's Disability Coordinator and the Director of its Office of Disability Integration and Coordination since 2022. Prior to joining FEMA, he led strategy operations and impact for the National Alliance on Mental Illness and served as an Executive Director of Paralyzed Veterans of America and Chief Strategy and Advocacy Officer for AMVETS. Sherman served in the Marines for 12 years and went on to obtain a graduate degree from the University of San Diego School of Business and the University of Dayton. Maggie Jerry is going to be joining us today from SAMHSA. She has her MDiv and is Senior Advisor in the Division of Trauma and Disaster Behavioral Health in Substance Abuse and Mental Health Services Administration within the U.S. Department of Human Services. Through her role, Ms. Jerry coordinates with government and non-governmental partners to support United States disaster and emergency mitigation, preparedness, response, recovery, and resilience efforts. Ms. Jerry has strong interest in the impact of extreme heat on people with mental health and substance use chronic health conditions, and has been contributing to federal planning and meaningfully incorporates people with lived experiences of mental health and substance use conditions in wider climate and extreme heat planning. Finally, we will have Megan Meadows, who is the Director of the Division of Energy Assistance in the Office of Community Services at ACF, and this administers the Low Income Home Energy Assistance Program, or LIHEAP, and Low Income Household Water Assistance Program, LIWA. In this role, she leads a team that collectively administers over $4 billion in mandatory grants to serve households with low incomes. And now I will go ahead and hand it off to Rick Nichols.
Hey, thank you, Casey. As Casey shared, I'm Rick Nichols. I serve as Chief of Staff at ACL. A huge thank you to Sherman, Maggie, and Megan, who are with us today. We are so appreciative of the strong collaboration we have with ACF, FEMA, and SAMHSA. I am a Caucasian male with dark brown hair and a beard. Both are graying. I'm wearing a white shirt, a navy blue tie, and a light olive suit jacket. My pronouns are he, him. Across the United States, we are facing both increased temperatures and increased frequency, duration, and intensity of heat waves. These last 2 weeks, a large portion of the nation has experienced record-breaking heat waves for the month of June. These heat waves resulted in more than 270 million people experiencing temperature at or above 90 degrees. Some cities and communities reach dangerous levels of heat conditions, with humidity pushing heat index values into the 100s, including in areas where this is not typical. It is critical for all of us to be prepared to manage the challenges and impacts of extreme heat now and ahead. Extreme heat has significant and often harmful effects on the health and livelihood of the communities that we serve. Extreme heat is by far the deadliest form of severe weather incidents, killing on average twice as many people a year as tornadoes and hurricanes combined. In 2023, 1,168 people died of heat, the highest toll in 30 years. Older adults and people with disabilities are more at risk than most for heat-related illness and death. Some older adults and people with disabilities do not adjust well to sudden extreme changes in temperature due to multiple chronic medical conditions that change the body's normal response to heat. Extreme heat in particular exacerbates pre-existing conditions like cerebral, respiratory, and cardiovascular diseases. Many older adults and people with disabilities also take prescription medications that affect the body's ability to control temperature and sweat. These populations are also at higher risk of heat-related illness during periods of high daytime and nighttime temperatures. Currently in the United States, there are more than 78 million older adults over the age of 60 and more than 61 million people with a disability. Heat waves triple the risk of death for people with pre-existing and psychosocial disabilities. ACL is engaged with agencies across HHS and the federal government as disability and aging subject matter experts to increase awareness of the effects of extreme heat on these populations. We participate in the National Integrated Heat Health Information System, or NIHIS Extreme Heat Interagency Working Group, and help to ensure the needs and preferences of older adults and individuals with disabilities are represented in this key work. We provide stakeholders and grantees technical assistance and training to raise awareness of programs and resources across agencies and organizations that address the dangers of extreme heat as they relate to older adults, people with disabilities, their families, and caregivers. We want to thank the many aging and disability organizations in our grantee networks that are doing exceptional work to address the heat and climate needs of older adults and people with disabilities in their communities. We also want to thank direct care workers and unpaid caregivers for the critical support that you provide in advance of and during periods of extreme heat. Recently, the White House and the Centers for Disease Control and Prevention launched a nationwide heat and health tool to protect communities most impacted by extreme heat. The Heat and Health Tool is the first nationwide tool of its kind to provide heat health outcome information at the zip code level and is helping state and local officials identify communities most likely to experience negative health outcomes from heat, ensure that outreach and medical aid reach the people who need it most, and help decision makers prioritize community resilience investments. Look for a link in the chat to this tool's website. ACL statutory authorities and unique position within the federal government gives us the opportunity to represent, advocate for older adults and people with disabilities and ensure their needs and direct involvement are considered in policies, programs, and research. We're very pleased with the progress being made to include the voices of people with disabilities and older adults in the development of systems of safety and in preparedness and response efforts being tailored to their needs. We also acknowledge, along with our partners, we have a long way to go in this regard in better planning for and responding to climate-related disasters and emergencies. Properly planning and preparing for extreme heat events can mean the difference between health, severe illness, and even death. ACL is committed to continue to advocate and partner across the federal government and with other organizations at the national, state, and local levels on behalf of older adults and people with disabilities to ensure their needs are accounted for in disaster preparedness, response, and recovery policies and programs. With that, I'm now going to turn it over to my colleague, Sherman Gillums.
Thank you so much, Rick. And it's so good to see all of you taking an interest in this important topic. If you've been anywhere in the US, you couldn't have missed the heat warnings across the nation. Now, as I talk about this, I'd like you to keep the number 7 in mind during this discussion we're going to have today. The body's resting core temperature is typically about 98.6 degrees Fahrenheit for most of us. This is only 7 degrees away from the severe harm that extreme weather can cause, such as heat stroke, heart failure, and dehydration, each of which can lead to death. Now, as I describe what happens as the human body approaches that 7-degree threshold, I'd like you to imagine how a loved one, a friend, or a neighbor with a chronic condition or disability would handle these situations. Let's start with heat stroke. Heat stroke occurs when the body responds to elevated temperatures by redirecting oxygen and blood flow away from the stomach and intestines toward the skin to cool down. When this occurs, toxins that are normally confined to the gut are released into the bloodstream, which can cause clots around the body, multiple organ failure, and ultimately death. Heart failure also occurs when blood flow redirects to the skin, except in this case, the heart goes into overdrive to pump more blood in order to keep a person conscious as the core body temperature rises, causing blood pressure to drop until the heart gives out. Dehydration occurs when excessive sweat causes a loss of liquids in the body that progresses into shock, causing organs to shut down from lack of blood, oxygen, and nutrients, severely stressing the kidneys, and can lead to seizures or death. Now, unlike dry heat, humidity heightens the risk by making it feel even hotter than the actual outdoor temperature. The denser or muggier the sweltering heat becomes in high humidities, the harder it becomes for sweat to evaporate, which is necessary to cool the body. When sweat sits on top of our skin, not only does this make it harder to cool down, a higher concentration of water in a gaseous state leaves less oxygen, which makes it harder to breathe and thus forces the body to work harder to beat the heat. Now, why am I describing these circumstances in sobering detail? Well, for one, many people have no idea how close they come to these dangers when they stay in the sun too long and develop things like sunburn or heat exhaustion. More importantly, though, when we give words to a problem like this, my hope is that it becomes easier to intellectualize the danger and thus easier to personalize for those who face the greatest risks. Now, before any of these happen, our bodies try to warn us, essentially making us human thermometers during heat events. Now, here's the thing about actual thermometers, though. There comes a point when the mercury rises so high, the pressure causes it to reach a veritable breaking point. And when this occurs in human beings, we call that death. Now, these scenarios are what we're asking our friends, our loved ones, our children and neighbors with chronic conditions, disabilities, and mental illnesses to endure and react to when temperatures rise to an extreme and their communities are unprepared for it. We're asking them to recognize the signs of imminent heat stroke, heart failure, or dehydration as their core body temperatures climb 1 additional degree at a time until it reaches 7 and beyond, which is the point of no return for too many. The fact remains that many people depend on others to make the right decisions for them. Older adults with dementia, children with autism, people who are housebound, people taking certain medications, and people like me who cannot self-thermoregulate due to medicinal side effects or medical conditions. Our challenge here is to stop people who already face tough challenges in their everyday lives from becoming human thermometers that reach a breaking point due to lack of preparedness. and for the 23,000+ people who died due to extreme heat in the US last year. It's too late. But as we anticipate the continuance of record-breaking temperatures across the US, there's still time to save others through effective communication, raised awareness, community readiness, and shared accountability, which is why we're all here. While it's okay to hope for the best, hope alone is not a winning strategy. Now, as you listen to our expert speaker, Maggie Jerry, please keep that 7-degree threshold in mind as you think about what it will take to educate and motivate your constituents to prepare themselves ahead of the next extreme weather event in their community before it happens. I thank you all being here. I thank you all for being here, and I look forward to a great discussion.
I'm waiting for Megan Meadows, so I just want to make sure that we have the right pattern here.
Thanks, Maggie. And Megan, yes, please jump right in.
Sure. Thank you so much. And thank you so much for having me here today. If it's possible to go ahead and share the slides, that would be great. But if not, I'll continue through today's presentation. Thank you so much. Thank you again for the opportunity to talk today. I want to share at the U.S. Department of Health and Human Services Office of Community Services, or OCS. We provide funds to over 200 grant recipients, including all 50 states, the District of Columbia, U.S. territories, and federally recognized tribes, over 150 federal recognized tribes in all. Next slide. So let me talk for a minute about LIHEAP. LIHEAP is a block grant, meaning LIHEAP grant recipients have the discretion to utilize their annual allocation based on the needs within their state or community. LIHEAP can be a critical tool to reduce the health and safety risks of extreme heat for households with low income. You may be familiar that LIHEAP can provide heating and weatherization assistance, but in addition, LIHEAP can also offer cooling assistance, summer crisis assistance, and help with purchasing, repairing, or loaning or replacing cooling equipment for eligible individuals and families. Next slide. Prior to sharing some of the specific ways that LIHEAP can provide cooling assistance, I wanted to share information regarding the allocation of LIHEAP funds in recent years. So as you can see, the allocation for funding during the last federal fiscal year has decreased by about $2 billion. I wanted to note this reduction as it has resulted in some grant recipients reducing or no longer having the capacity to provide cooling assistance. As I mentioned earlier, LIHEAP is a block grant, so it is based on the grant recipient's discretion on how to utilize these federal available resources. Next slide. Data has shown that the low-income households spend 3 times more of their income on energy costs than more economically stable households. 67% of low-income households experience high energy burdens. Black and Hispanic households have energy burdens that are 43% and 20% higher, respectively, than white households. LIHEAP can be a critical resource to ensuring that a household's energy burden is reduced overall. Next slide. As I mentioned previously, some of the types of cooling focus assistance that LIHEAP can provide. I wanted to also share some additional flexibilities regarding LIHEAP funding. LIHEAP can also provide access to cooling centers, as well as coordinated targeted outreach to households at greatest risks during periods of extreme heat, such as older adults, children, and individuals with family. LIHEAP can also help provide educational resources to households in danger of extreme heat, and I'll share some examples of those resources in the upcoming slides. Next slide. In fiscal year 22, LIHEAP provided $623 million in cooling assistance and served over 824,000 households with cooling and summer crisis assistance. In response to the assistance provided during extreme heat, the OCS created the LIHEAP Extreme Heat Dashboard. This dashboard is a great resource for grant recipients and stakeholders and provides information on extreme heat over time and the health impacts of extreme heat. The LIHEAP Extreme Heat Dashboard compiles resources from the CDC, the National Integrated Heat and Health Information System, and other sources so that grant recipients can be informed when making decisions regarding program implementation. And my colleague Heather, I believe, is going to be posting links in the chat for these resources available. Next slide. The last resource I wanted to share with everyone today is the LIHEAP Toolkit webpage. We launched this webpage last year as an additional informational resource for grant recipients and stakeholders. The LIHEAP Toolkit webpage provides resources for heating, weatherization, and cooling. Resources on the webpage include informational flyers, a social media toolkit, and safety pamphlets. OCS has also worked hard to lift up voices from the field by creating spotlight videos. On each of the pages I've discussed today, you can also take a moment and watch a video and see and hear the impact of LIHEAP can have on households in need. Additional videos can be found on the Administration for Children and Families YouTube page. The last two slides provide additional information and links to resources and our contact information. Next slide. I want to emphasize the energyhelp.us page. This resource is available for households to quickly determine if they might be eligible for assistance. By answering a few simple questions about their home, the system will then determine if the household may be eligible for assistance and, importantly, where to go for next steps. By visiting that page and sharing this resource with the homes that you serve, households can also have a phone to call in and seek additional assistance. And then again, that eligibility tool where they can know where to go for next steps. Again, I truly appreciate the opportunity to share information about LIHEAP and the program can have on households in need, especially during these extreme heat situations. Thank you so much, and I look forward to the additional discussion.
Thank you, everyone. And I want to first say hello. My name is Maggie Jerry. I am also a white woman with lighter gray hair. I'm wearing an orange necklace, a blue striped shirt, and I have a virtual background that is kind of blue with some words of empowerment that come from my organization, the Substance Abuse and Mental Health Services Administration. I also use she and her pronouns. I want to thank ACL and the FEMA Office of Disability Integration and Coordination for inviting me to share information and ideas regarding the current urgent topic of extreme heat and understanding its effects. I want to, of course, take a moment also to mention my agency, the Substance Abuse and Mental Health Services Administration, which is the agency within the United States Department of Health and Human Services that leads public efforts to advance the behavioral health of the nation. Our mission is to lead public health and service delivery efforts that promote mental health, prevent substance misuse, and provide treatments and supports that foster recovery while ensuring equitable access and better outcomes. We envision a world in which people affected by or at risk of mental health and substance use conditions receive care, thrive, and achieve well-being. Before I say anything else, I want to emphasize a few key points that I think should be foremost in all of our minds. First, how we talk about extreme heat and climate affects people's mental health. As we talk about data that is alarming, and I will be sharing some data that is alarming, we must think in terms of actions that we can collectively take and that we can take as individual people. Our communications must be actionable. Second, we just celebrated the 25th anniversary of the Olmstead decision on June 22nd. With that in mind, it's important to recognize that people with mental health conditions live independently in our communities and have a right to live in communities. As well, people with mental health and substance use conditions, in particular, people with substance use conditions who are in treatment, are considered a protected class as people with disabilities under the ADA. People with disabilities are covered under equity and diversity, equity, and inclusion efforts. Third, rising temperatures are an immediate public health and environmental hazard that interact with our health through a combination of factors. Three factors in particular: our physiology, our physical bodies, much of which Director Gillums was discussing in his opening comments. Our environments where we live, work, and gather. That's the second factor. And the third are social factors. And those social factors include our individual situations, but also the way that professionals and agencies view the scope of their work. All of these three, physiology, environment, and social factors, are interacting with our mental health and substance use health as well. My goal is to organize my comments in a bit around those three factors, but I want to add a few more thoughts. So fourth, some of the challenges ahead related to our approaches to saving lives and keeping people healthy in the context of extreme heat will have similarities to the challenges we've been seeing in the COVID-19 pandemic. We must counter myths and stigma related to who is at risk and why, and plan with a focus on the people who are the most vulnerable as our center, as the centering of those folks. That then leads to safer communities for everyone. This builds on the basic concepts of the ADA, the idea that planning for access improves the lives for everyone. And underneath this, we need to really understand that there have been myths that when we see what's called excess mortality, excess deaths, that those are people who would have died anyway, but maybe they died a little faster. This is one of the types of myths that can occur in extreme heat. We really need to counter that. We need to counter some of the ideas about the value of the lives of the people who are most at risk, and understand stigma and how it plays into our planning. We need then also 2 more points. We need to bring people with lived experience into all aspects of heat planning, from community and services planning to public health messaging. And then lastly, while there are many areas of climate impacts that we are all collectively working to address in our planning, the effects of extreme heat are immediate and deadly. This requires that we have a massive shift in public health messaging and awareness immediately, as well as the strategies that we use to provide safer environments and more effective coordination during these events. That was a lot. I'm now going to move to a few comments about some recent reports and statistics that I think are really important for people to be aware of. One of the recent reports is from Maricopa County, which is in Arizona. It's the area where Phoenix is located. The 2023 heat-related deaths report out of Maricopa County showed that 645 people had died in 2003 for deaths that were considered to be related to extreme heat. That's for just the county of Maricopa. That's not the whole state of Arizona. Of the people who died, 3 out of 4 were male. 2 out of 3 were over the age of 50. 3 out of 4 had injuries that from the heat that occurred outside that then led to their deaths. 80% of the people who died were residents of Arizona. And having spoken with the Department of Health in Arizona and the leaders in heat planning, they also shared with me that a majority of the people who died had lived in Arizona more than 20 years. 65% of the people who died from heat-related deaths had a corresponding substance use condition. 65% had a corresponding substance use condition that interacted with that extreme heat and was a contributing factor in their death. 45% of the people who died were experiencing some form of homelessness. And 1 out of 2, or in other words, 50% of the people who died had a medical history of a physical / mental health condition. This is something where I would ask the department to clarify whether they're referring to different types of physical conditions or mental health as a physical condition. And then 71% of the deaths occurred on days that were excessive heat. There was an excessive heat warning, which means that around 30 more percent or 29%, or I'm really bad at doing math off the top of my head, really died outside of that excessive heat warning. So I'll touch on that very briefly. I now want to compare that report, which just came out of Maricopa County in April, with a report that New York City just published in the past week to 2 weeks looking at deaths from 2013 to 2022. I'm sorry, 2013 to 2022. So looking at a range of almost 9 years. Once again, in this data, we see that people over age 60 who were male had a higher rate of death. Additional factors included living in lower income neighborhoods. And then a key factor was being Black, non-Hispanic, or African American. Unlike the Arizona data, a majority of the deaths in New York City were from indoor heat exposure, not having access to air conditioning that was a significant factor in those deaths. And this was coupled with social factors related to the cost of paying for air conditioning, such as the resources that LIHEAP seeks to address. The cost of paying rent in neighborhoods where the built environment would reduce your exposure to extreme heat. In other words, that some neighborhoods have higher heat because of histories of redlining and different types of built infrastructure. Similar to the data in Arizona, having chronic health conditions is a huge risk factor, including disproportionately high rates of death for people with chronic behavioral health conditions. 32% of the people who died had evidence of alcohol or substance use. 26% of the people who died had evidence of schizophrenia, schizoaffective disorder, cognitive or psychiatric conditions. And then combining with this, 58% of the people who died had one or more chronic condition, health condition, respiratory hypertension, cardiovascular conditions are particularly relevant. We also know that many people with the behavioral health conditions have these other types of kind of what would be called comorbidities or other types of chronic health conditions as well. So all of this data is in line with what we've seen over many years. I used to be a planner in New York City, and I was aware that people with schizophrenia were more likely to die in extreme heat events. We saw a report coming out of British Columbia last year showing a 200% increase in heat-related deaths for people if they had schizophrenia. And in 2021, Arizona estimated 42% of their heat-related deaths had a substance use condition that was related. But there are two other things I want to mention. I've just really emphasized how this is so critically important related to people with disabilities who have chronic behavioral health conditions. I do want to touch on two other impacts of extreme heat that affect everyone. One is related to sleep. So there have been studies that adults over age 50, for each degree of warming, have a loss of sleep that's 2 times that of people who are younger than them. People who are lower income have sleep loss or live in lower income neighborhoods, have a sleep loss of almost 3 times that of people who live in higher income neighborhoods. And females have a higher loss of sleep, 25% more than males. These studies were done based on people around the world, not just in the United States. We've also seen that extreme heat, we're seeing more data that shows what's called excess or increased hospitalization rates for mental health and substance use conditions directly. So a recent study in 2021 looking at insurance data showed increased rates of hospitalization for people in all categories of acute psychiatric and substance use disorders in extreme heat events. Well, that was a lot of data. I know it's alarming. We've talked a little bit about the physiology, and I'm so appreciative of what Director Gillen shared. I'm excited. Here's one of the things I'm excited about, having been involved in this work for the past 2 years very intensively across our agency, the U.S. Department of Health and Human Services. One of the things I'm excited about is that the CDC published guidance that really gives clear information about different types of medications. And I have dropped this in the chat, but it is also something we'll follow up with in this meeting. We hope to share some links to some of the resources I'm mentioning. The CDC guidance on heat talks about a number of areas, but to my knowledge, this was the first time that in the United States federal agencies, we have a publication that shows different types of medications and how they interact with the body's ability to thermoregulate in heat. I'll mention briefly that the New York Times did a really excellent review of how to stay safe in extreme heat. And I have reviewed that and thought that their recommendations were quite good. One of the things I like to emphasize is, I know this isn't possible for everyone, but actually, if you're having a heat reaction, if possible, getting into a bath will have a significant effect. So showers and baths are extremely important, and having that water bring the heat out of your body happens immediately. We all need to learn more about what it is to feel the effects of extreme heat and become knowledgeable of when our bodies are telling us to take immediate steps for protection. We know it's important to not go out at certain times, but we also perhaps are not as aware of how this interacts with the body's inflammation. And some of the effects of an extreme heat exposure can last longer than even you realize after you're starting to feel better. So there's really a need to kind of enhance our understanding of that and how this also interacts with our brains, our neuro kind of cognitive thinking once we've started to feel the effects of extreme heat. There's a type of extreme heat of physiology and experience of heat stroke that's called classic, and then there's one that's called exertion when you're exercising. So in some of these classic extreme heat exposure events, we're talking about people who are older and people who are younger. Children and older adults have some of the more difficult times processing that extreme heat exposure, and then people with certain medications, which we've been discussing. So that's a little bit on the physiology. I want to take a moment on the environment. I've dropped another recent public-facing attempt at public education that I was a part of, which is a global heat effort where there was a kind of a quiz that you can take on indoor heat and understanding whether you the myths and the facts about indoor heat. This is for an audience of people around the world, but it will hopefully be a way to learn as well. We're seeing a lot of work happening around heat islands, built environment. In essence, we really need to do more to look at this, not only at the individual preparedness level, but really how we have built our communities, the policies we have in place. Even I think New York City has looked at landlords and what they allow or do not allow in terms of air conditioning temperatures and so on. And I also have information about recent work by HUD, a press release that they're working to look at the effects of extreme heat. So let me just then talk about the social side, which is, I think, an area that many of us who have worked in emergency management, disaster work, and the work to really integrate disability in disability rights, disability integration, functional access into emergency management. You know, this has been kind of that interaction around how do we understand not just what we think is the hazard, but the social experience and the kind of the social location of different groups of people and how we plan, and also how we kind of adjust our whole environments. So some of the factors that we know are risks in extreme heat include isolation. So we know that there's work happening to really address isolation and loneliness in the country, but this is a definite risk factor, the need for social connectedness. Another risk factor that we have in emergency management is perceiving that this is a routine response, and how do we grow out the routines versus seeing the novel and the new aspects of this work and what we need to do to really kind of change our whole way of thinking about it. For example, a paper that was just published that I read about this morning coming out of Virginia was looking at data. It had much of the same that I just shared around who died, including African-American people, people over the age of 50, people who were male, but where they died was not what was expected. They were not always in the neighborhoods where that kind of that threshold of heat and the intensity of the humidity was being mapped as the most severe. So we have a lot more to understand in all of this. We also need to change how we communicate. There's another publication that I'm going to drop here for media on how we communicate about heat waves. I think right now people are starting to see this is a really serious hazard. It's an environmental hazard. We need to take it seriously as we would even in the environmental justice world. I would consider this an environmental justice concern for people with serious mental illness and substance use conditions, because people with these conditions are disproportionately impacted by exposure to this particular hazard. And then lastly, I want to drop and share some information about SAMHSA. You know, we have this unique role, especially with our partner agency, ACL, in really having a seat at the table to talk about the experiences of people, the lived experiences of people with mental health and substance use conditions. And in our agency, we also have a lead role in disaster behavioral health. I work directly in the section of our agency that supports the disaster distress helpline, which I know has been very well received by many people in disability rights communities, in part because it has an interface for people who are deaf and hard of hearing that I have heard wonderful feedback on. The disaster distress helpline is available also related to the distress that a person might be feeling in an extreme heat event. We've helped to link that resource into heat.gov, and we're starting to promote it more widely. Last year, we developed a toolkit or tips sheet on preparing, if you're taking medications, preparing for hot weather. And then the last three resources I'm going to mention and then I'll leave it to our questions and answers, is that we just published 3 resources related to climate in general, but we talk about extreme heat in particular. One of these is a resource called The Dialogue, and our most recent publication, Impacts of a Warming Planet, includes 2 very excellent articles and an infographic around what it means to take action, to be part of our communities in finding solutions in these events. We have published an infographic on taking action to build a more resilient world, and that is focused on a lot of different audiences of people who may have influence in planning and policy, as well as community members. And then we've just published another supplemental research bulletin on climate and behavioral health. Thank you for giving me a chance to make these comments and to share this information. Thank you.
Oh, wait, we're having, oh, there we go, some technical issues. All right, thank you so much to everybody on the panel. So we're going to go ahead and dive into a few questions to pose to all of you. So the first question is, what strategies can enhance older adults and people with disabilities resilience during periods of extreme heat?
Helpful. I'll go first. Maggie and Sherman, you guys hit several. I'll just look to add to that. I think during extreme heat, Maggie, you called out well, a cool bath or shower can make a great difference. Air conditioning, of course, can provide immense help, even 1 to 2 hours of it. If you do not have that at home, I think it's important for individuals to have in mind how to get to a cooling center. And know those well in the community. Hopefully the word gets out, and that's a critical role that organizations can play. I had a conversation with a neighbor yesterday, and they shared about their father who lived in the Sun Belt, mid-80s, had not turned on their air conditioning just yet. And so part of it is really just ensuring that individuals have in mind that there's a certain point at which cost-saving measures should no longer be your priority. You really need to focus on your health. And if your body really doesn't quite know the difference, or you run cold, there's a certain point at which you really need to implement these preventative measures. Stay hydrated. Maggie, you stated well, those with substance use conditions, this can be very dangerous. When you're trying to hydrate, it's important to stay away from alcoholic beverages, coffees, caffeinated sodas. We need to be careful with the amount of time that we spend outdoors and go outside, especially for exercise. Really limit that time, do what's needed. Ensure you know from your doctor. We talked about prescription medications, the effect of those, how they might have an impact on heat-related illness for an individual. We also need to have in mind when it comes to fluids, can electrolytes be a source that's helpful? When should we also avoid those depending on our health situation? Draw your curtains. 40% of heat in the home can come through windows. So have in mind how to regulate with that. Wear loose clothing. Do not run your oven. I think it's critical for people to understand, especially for older adults, people with disabilities, they want to be independent and they are proud of how they live independently in the community. During a power outage, it's not wise to be alone. So ensure that we're in contact with family and friends, and ideally just not be in a place where you're alone. Stay out of a hot vehicle, keep others out of hot vehicles, especially older adult, person with this disability, child, whoever it may be. And we just need to take heat seriously and not ignore the danger signs, as has been said in so many ways when it comes to nausea, dizziness, and fatigue. Others want to add anything else in this?
Yeah, I would add in that, of course, for our low-income customers, whether they're seniors, disabled or young children households, which LIHEAP targets actually, to apply for the low-income home energy assistance program. And Megan mentioned this during her presentation. Go to energyhelp.us. It's just that easy, or have them call 866-674-6327. Apply for that assistance now. If they are in a disconnect or termination, that raises that level of urgency because we don't want them to lose their power, which could include their air conditioning or their refrigeration, and just be cognizant of that. So if they're eligible, let's get them in, let's get them applied. Please note that if they're about to be terminated or disconnected from services, we need to prevent the electricity from being shut off and get that reconnected as soon as possible. And, you know, the other thing is that LIHEAP is a block grant, so it's up to the grant recipient what services are provided. But some grant recipients, states, tribes, and territories will provide air conditioning units. Maybe that's a window unit or one unit to cool one room in the home. And then also they will also provide, you know, not only assistance with the electric bill, but that air conditioning unit. Sometimes they lend that to you. Sometimes you are allowed to retain that and keep that. They can also make minor repairs to air conditioning units. So if someone's having problems with their AC unit, minor repairs can be made to make that work. They're going to assist with that. We do caution people who are using fans. If they don't have air conditioning, they need to be really careful of that. Fans can actually exacerbate the heat in their home. But, you know, ensuring that they have an air conditioning that's being used. If they have ceiling fans, it's being used in conjunction. But importantly, too, I've heard creating buddy systems to check. So having intake workers or volunteers go check on the elderly, disabled, and families and saying, are you okay? Because with social isolation, people don't reach out for help. Sometimes it's a matter of stopping by, making sure they have air conditioning, make sure they're turning it on. Some of our elderly families do want to be self-sufficient and don't want to have that bill. And they wait a long time before they turn on their air and don't even notice that it's impacting them. So creating that buddy system, and then if needed, get those people transported to a cooling shelter. If their air is out, if there are problems with their housing, let's get them to a cooling shelter at least during the hottest parts of the day. So those are some of the things that we are encouraging people through the Low Income Home Energy Assistance Program to do, and trying to meet and during these extreme heat events.
And Heather said everything I was going to say, so I'm just going to add one thing. Take advantage of what technology offers. There's this thing called the Nextdoor app, and typically people will talk about their experiences as these things are happening. And the one thing we don't want to do is have people reaching out because they don't have transportation. They don't know where a cooling zone is. Maybe they live in a crime-ridden neighborhood and they don't want to open their doors and windows, which happened in Chicago in the mid-90s. But now we have technology that connects us. So let's watch social media, maybe have mom and dad if they're older, check in every now and then. Ideally, you want to check twice a day during extreme heat weather events, because they may be fine at nighttime, and then in the daytime it accumulates. So I would say, yeah, let's stay connected in ways that we didn't have in past times. But everything you said, Heather, was right on. Thank you.
And the other thing I would point out too is that Meals on Wheels, you guys are out there in the community-based volunteers that are walking into a home. It's critical to refer that home to assistance. And so if they need to make a connection with the low-income home energy assistance program to help someone get their air conditioning or get them to a cooling center, we all need to work collaboratively together to make sure that we ensure people are safe and that they can get through these extreme heat events.
Okay, I'm going to add to this from lived experience. I am from Southern Arizona. I live in Tucson, Arizona. I grew up in Tucson without a car. Now, people think I didn't know how to drive because I lived in New York City as an adult, but that's not why. I lived in a household that had less than $500 a month for 3 people. My mother had schizoaffective illness. She's no longer with us. I currently live in Tucson, and I'm an older adult now. I did not understand extreme heat. I forgot. And I almost died doing an errand my first year here because I decided to ride my bicycle and I did not take 106 degrees seriously because my memory of 106 or what I was capable of was different. I won't get into the whole story, but it was ironic because I'm on the National Steering Committee for Heat Health. It was ironic because when I got home, I could not lift my limbs and I had to go into my swimming pool in my condo building in my clothing and watch my watch to see my heart rate come down. And I completely underestimated the level to which this could have had a long-term effect, and I could have died even days later. Now, that was me in my 50s in Tucson, Arizona. So I'm sharing that with you because I think we need to be grounded here. Most people in Arizona, where I am, we're stubborn and we're from here and we know heat. So we don't want to use these tools. It's both cost, but it's also what we're normed to. I grew up with something called swamp coolers. The idea of air conditioning was something I didn't like. It didn't feel good to me. I like the experience of extreme heat in my body because I grew up here. So what I think the statistics in Arizona are showing us is if you think you know this because you've grown up with it, we're dealing with a different type of heat these days. And also, it's not easy for us to get used to who we are today. We're not the people we were 10 years ago. We're not the people we were 20 years ago, and our bodies have changed. And so I think that these are critically important things to communicate. I also think that, the average person in Tucson, like where I live, if they do not have a car, it is very difficult to get to cooling centers. So, we're seeing different kinds of strategies here in terms of using buses and other approaches. And what they're doing in Phoenix in terms of innovation is they're bringing harm reduction techniques into their cooling centers. So we need to see different thinking at the city government level, at the state government level. We at the federal level support that. They are the leads. In terms of how we help our, let's say, behavioral health providers know how to be in the conversation. Most of the organizations that SAMHSA funds or interacts with think of themselves as primarily focused on providing mental health services. They're not necessarily thinking about trying to partner with the local cooling station. But what we're finding in Phoenix is there's a real need to integrate these harm reduction approaches for people who are using substances into those cooling centers. And I'll just lastly say one thing I'm still trying to understand, and I don't want to be overly alarmist, is the fact that you can go to a cooling center, come home, and actually still have the fatal effects of extreme heat exposure, not only because of air conditioning, but because of that longer term effect that it has on a body with inflammation. So it's a bit like, let's say we hit our heads. We had a traumatic event where we don't know it's a traumatic brain injury. We think we might have a concussion, but we're not sure. I think we need to think in those terms, like, I don't know if I have a concussion. I'm monitoring right now. I had an extreme heat exposure. There were some effects. I went to a cooling center. I got some interventions. I brought my body down. But now, because I'm very well informed, I'm in touch with the healthcare providers so that I do take steps if there's something that comes up and I need to go and get emergency care. This can occur even months after an extreme heat exposure in your body. So we all need to change how we think. The systems need to change how they think about these things. And I think we do have to think of it the way we did with the pandemic. I know that's a little outside the box, but in terms of who's most at risk, communities of color, people with chronic health conditions, we cannot be complacent. Thank you.
Piggybacking a bit off of the last comment that you made, Maggie, I'm really curious if an organization, grantee, or stakeholder wants to make a difference in environmental or disaster policy and programming, what would you suggest that they focus their attention on?
Well, we all need to be paying attention to what's happening around what's allowable for built environment, how things are changing, tree canopies. We need to be engaged in those efforts to be a voice at the table. And then if we think it's not my lane, it's not my role, this is a novel situation. So it means that there are a lot of folks there's things that need to get done. It's nobody's job right now. We need to be willing to lean in and say, I get that, I don't want to take on something that's not my role, but we need to really be serious about where the gaps are and really understand this requires a novel approach. The stressors that happen in a massive disaster often push collaboration and drive innovation in the field of disaster work. I believe extreme heat is doing that for us now. It's probably the sleeper event. Like we were thinking hurricanes are going to be worse, coastal erosion. We're planning for that. And now suddenly extreme heat, which was driving a lot of these other events, is coming up as a deadly killer today. So we have to basically pivot and think about this as a completely new approaches. And then how to be at the table, get that folding chair and show up.
And it would behoove communities to understand that they are the first responders, right? Most heat events that aren't accompanied by a tornado, hurricane, they're not going to be a federal declaration. And the states and counties and localities are expected to manage mass heat events absent other weather-related events. So you're it in many cases. And when you have many people dying in one area at the same time, it's in everybody's best interest to work together because you all are, in fact, the stakeholders and the first responders for that particular community at that moment.
If I can add to, and Maggie, you got to warning systems earlier on, the role that media plays, public health agencies, really any agency that is serving and supporting populations out there. We really need to tailor this information. Not only does this need to be a dinner table conversation, Sherman, you mentioned we need to be getting to people multiple times a day. Heather, you mentioned organizations like those that serve Meals on Wheels. It's great when there is someone who is going into someone's home to provide that service or support. They have a way to be checked in on in that regard. But we need to ensure we're building communities around individuals. They understand that there is technology that can be used. What are the hotlines that can be utilized so they can get information in those moments? I think key with these warning systems for people that are at risk, they really need those messages that are tailored to them. What is going to make the most difference for them and their needs so that they truly can create their own plan and work with both individuals who are part of their approach for care and independence, and then also for unpaid caregivers, family members, really having that understanding of how they can really help individuals and themselves really find a way through these extreme heat scenarios. It's also important that these warning systems, the information that gets out there, it's accessible. We really need to ensure that individuals from all walks of life, but especially those who are people with disabilities, whether they are blind, visually impaired, deaf, have hearing impairments, intellectual disabilities, they're truly able to get this information in a way that they can use it. Maggie, you said well earlier, people need to know how to take action.
So I have two final pleas for the group before we close, and we're already at time. One, Disability rights groups have made such an enormous impact on the world of emergency management. And I'm so happy that these groups, independent living centers and so on, have been including people with psychiatric disabilities, especially in the past 10 years. I've seen that trend more and more. I just urge and I send a plea to these groups to really, really intentionally start to reach out to recovery community organizations, start to reach out to consumer survivor groups and family-led groups that SAMHSA would typically be involved with. Let's look at ways we can partner, ways that we can help those organizations think about having a seat at the table and why they should want to. I think that's work to be done. And then I'll just leave it with that. That's my plea. Thank you.
Okay, we are just a little over time. Thank you everyone who was able to join us today and was able to stay on for the entirety of the webinar. And thank you so much to Rick and Maggie and Sherman, Megan and Heather for joining and giving us such a insight into extreme heat and the way that it's impacting all of the individuals that we serve. So we are going to close out the day, and we see all of the questions in the Q&A, which we will add to our repository. Thank you all and have a great rest of your week.
Water, everybody.